My name is Ruth I'm in the Health Leadership Program. I just finished up my BSN. This is my horse, Lexi. What does it mean to be a nurse? And what do I value? To be a nurse means to care for people at their most vulnerable. It means to be at a place where you can guide, educate, take care of people at times when they are afraid or unsure. Nursing is not just a profession. It's who you are, even though it's not just how we believe, but our beliefs do affect how we care for others. Nursing is something that I've longed to be my whole life. My dad was in the medical field and never finished. He always stressed to us how important it was to be a servant to others. And so it took me a while to get to be a nurse. But I've been an RN for 13 years, an LPN for 2 years, an aide for 2 years, and before that I did something totally different. It was a professional dog and cat breeder for 30 years. So I have some work ethics behind me. Nursing experience, most of it is at critical care hospital here at Deer Lodge. We stabilize and ship patients. There are many we care for. We do outpatient services, we do infusions, but we're it. We're respiratory therapy, we're physical therapy, we're med surge. Oh, we don't do OB anymore, but we do pediatric to geriatric, beginning of life to the very young. The joys of nursing is it gives me a completeness. I can put my whole self into it. But I think it's very important in this field especially that we know how to care for ourselves. This is one of my outs, and one that loves me back and gives me a fulfillment. It's a healthy outreach. I could think of many more that help me in my nursing profession. I want to go farther. I was able to do a medical missionary trip twice to Africa. I was able to work as a nurse practitioner on that level, and it opened a whole new field for me to pursue a career of furthering education, which I feel is very important. The other work experience I've had is I've worked at a psychiatric hospital for 8 months. I've worked hospice for a year. I was a school nurse for 3 years. Everything that we do experience-wise adds to who we are. Life experiences add to who we are. Maturity and living through a death of a loved one makes us more compassionate, and those are the things I hold important. Integrity, honesty, compassion, how we treat others. Ethics is how we treat others, and using our morals and it is not just religion. It isn't a religion, it isn't a belief system, and yet it's how we care for others to the best of our ability, and be the advocate between the patient and the provider. Stop. Ethics and policies are important because it gives us, and the Nurse Practice Act is important to live by and follow and learn the policies of your, not only of nursing, but of your facility where you work at, because it guides our profession. It guides us in the everyday work of treating patients, of what is proper, what's not proper, how to treat the patient as the center, and cover as many things as possible. And if you have questions, you can revert back to the Nurse Practice Act. Benevolence, maleficence, there's many other qualities that we live by to not harm our patient, to do good for the benefit of the patient. regardless of how we believe in it. It's important not to put our belief system, to instill that to others, but at the same time it's important to use the things that we believe to better who we are and to provide the best service we can.